Hello, everybody, joining us on this US Eastern Time afternoon, 1 p.m. So wherever you are in the world, I see Rahul Kumar from India. Thank you for joining. And I know we have people from Europe and really all corners of the world. Our guest today is actually, he is originally US based, but he's going to be speaking to us from his new home where he lives in Buenos Aires in Argentina. So it's an exotic guest we have for you today. So really, thank you everyone for joining. If you've joined our webinars before, you're kind of familiar with the format. If you're new to this, so just so you know, so we'll be here together for about 60 minutes. The first part will be a presentation by our guest today, and then we'll move into more of a discussion and Q&A. So I'll open the stage to you to ask any questions you would like to ask. You always have the option to punch in any comments or questions into the chat box on the right-hand side of your screen. And you can also wait till the last 20 minutes when we open the stage for you to ask any questions, and then you can type in any questions you have. You have a chat box on the right-hand side of your screen, but you also have a Q&A box as well where you can actually type in questions. And I'll be reading those out to our guests today, and then we'll go back and forth and have a bit of a discussion around the question. So use this as a open space, free space to learn and ask any questions you have. Super exciting. Our guest today, Ryan DeBell. I hope I'm pronouncing that correct, Ryan. He just wrote a message here in the chat box, so spoiler alert. He is a chiropractor in education, but is here to talk to you about a few different things that are extremely relevant to all manual therapists or body workers. Any of you who is a manual therapist, chiropractor, massage therapist, body worker, knows how demanding it is, because you're always putting the effort in, literally physical effort in yourself every day to help other people. But a lot of the time we miss, because we're so busy helping others and using these manual treatments on others, we forget about ourselves, the fragility of our own bodies, and the long-term success that we're trying to instill for ourselves, so that we're able, to perform in your career for a long time, but also able to help other people for a very long time. So extremely happy to have Ryan here today. Extremely happy that everyone has joined. If you haven't yet, please subscribe to our different social media channels on YouTube, on Facebook, on Instagram, for a lot of free informational material, free content that we throw out on a regular basis that is always helpful, always educational, worthy, and is designed for individuals like yourselves, manual therapists, chiropractors, massage therapists, athletic trainers, strength and conditioning coaches, etc., etc. So enough said by me. I'll be here with Ryan as part of the discussion later. But Ryan, I'm going to put you up on the stage here now. I will give you the main stage. I'll step out. So the stage is yours to start the presentation. If there's any issues, technical, I'm here with you, so don't worry about that. And if anyone has any comments, any questions, please use the chat box, which I'll keep my eyes on, and I'll read out any comments or questions that are relevant for this for the purpose of the presentation. And if not, we'll save them for the Q&A at the end. So Ryan, thank you very much for being here. Good luck with the presentation, and we'll connect in about 20 minutes for the Q&A and discussion.
All right. Yeah, thank you for having me and inviting me to present, and thank you to everybody who is taking their time out of their day to come be here with us. I'll do my best to make sure that this is valuable learning experience, to get some useful information and tools and things like that. I'm also going to be kind of like monitoring the chat, so I'll try to respond real time if things come up. So basically the premise of this talk is I did a deep dive into the research on soft tissue work, and mainly because like when I was practicing at a sports chiropractic office, and I did a lot of manual therapy, body work, all that type of stuff. And I always saw great results from doing this type of work, but there are so many naysayers on the internet that say like manual therapy doesn't do anything, like IASTM doesn't do anything, it's all just hocus pocus. And I personally saw that that wasn't true, and I'm sure a lot of you obviously have the same personal experience. And I wanted to know like what research is out there that I can point to and say to those naysayers, and also to myself to support my own, profession and understanding of what's happening. What are like 10 really good studies that show a variety of things that I can point to and say, look, this is actually one of the things that this type of work is doing. And so I read through like hundreds of studies, and what I did was I found the 10 that I liked the most, and I put them into a PDF and summarized them and gave a little bit of analysis. And I'm going to go through that with you guys and explain each of these studies, what they did, what we can take away from it, what are the practical applications. And so I'm going to pull up that document now. Okay, there it is. Very slick. Okay. So I call this document 10 studies every body worker should know. And yeah, we should be able to send this to you guys afterwards. So let's just get right into these studies. So the first study that I want to talk about with you guys is this one. This is the name, T1P mapping, blah, blah, blah. You can read it. But basically, what this study did was they took people who had elbow pain, and they did this certain type of MRI that measures the amount of water that is bound or unbound in the extracellular matrix, essentially. So they looked at that, and then they looked at the what's called a DASH questionnaire to measure the disability and the pain levels of these people. So what they did was they took an MRI of the elbow, then they did fascial manipulation, like the actual, like the company's protocols, fascial manipulation. And they looked at the changes in the DASH questionnaire score and the changes seen on MRI of the bound and unbound water. And what they found was that when there was more bound water, and I'll explain what this means. When there was more bound water, it correlated with improvements in DASH score questionnaires. So decreased pain, improved function, etc. So why does this matter? So we have to think a little bit about biochemistry for this particular study, which if we look at the structure of the ground substance in the tissue, the extracellular matrix, there are a lot of glycosaminoglycans, and specifically hyaluronic acid. And hyaluronic acid is a molecule, it's a really long molecule made up of disaccharides. So basically 2 sugars attached to each other, and they can be 25,000 chains long. And that molecule has slight polarity. And so it will normally bond with water in a hydrogen bond. So you would have thousands and thousands potentially of bonds of water binding with hyaluronic acid in the extracellular matrix. And what can happen, the reason that there can be unbound water is because these long molecules can kind of get folded up on each other. And so imagine this 25,000 long chain molecule getting folded up. It doesn't have the space to be able to hydrogen bond with water. And so what they talk about in this study is that you can actually sort of get these aggregated hyaluronic acid molecules that are sort of twisted up. And you know that by seeing that there's unbound water in the extracellular matrix. And so they do this fascial manipulation, and they work the tissues manually, and then they see that there's more bound water, which makes us think that because these aren't like metallic bonds, these are hydrogen bonds, they're weak, that the physical pressure of doing this type of work uncoils a little bit these high hyaluronic acid molecules, and that allows the water to bind to it, and then you get a more fluid and better functioning extracellular matrix. So it's like the molecules can sort of slide over each other smoother. And one of the other things they mentioned in the notes on this study was that, and I don't know this if the extent of truth to this statement, but basically, like, if you don't have the hydrogen bonding correctly to the high hyaluronic acid, it creates like a little bit of a polarity in the extracellular matrix. So that means like the action potentials of the nociceptors can be set off differently. So you like have a lower threshold to set off nociception. So my conclusion from this study, like, is that doing fascial manipulation or other forms of manual therapy can, like, one of the mechanisms for improvement can be that we're changing the water that's binding to high hyaluronic acid, and that's why we can see some of the effects that we see. And so it's a pretty interesting study. I think this came out in 2020. And again, if you get a copy of this document afterwards, a free document, you can go look into the details of this and review it. So that's essentially the summary of study number one, is that that's a mechanism, and there's good evidence to show that that might be what's happening. Study number two, oh, I love this study. This study looked at, basically what they did was people who got their gallbladder removed in a hospital, they took the group of people that got in the study that had their gallbladder removed, half of them had normal recovery in a recovery room. The other half got a foot massage by the, I think it was the nurses at the hospital. They got I think it was a 20-minute foot massage, 10 minutes per foot. And what they looked at to see like what the effects were, like, how do we know, like, what are we looking for to know if this was an effective use of massage, is they looked at the pain levels, like an oral pain scale, 0 to 10. They looked at how much analgesic medication the patients requested, and also they looked at reported anxiety levels. And the results were that 2 hours after surgery, the people who had foot massage, they reported a 1.26 out of 10 compared to a 3.6 average pain for those who did not get foot massage. Everybody got sort of the standard analgesic care afterwards. So even the people who got foot massage still took analgesics, but they were allowed to request additional analgesics for pain. And the people who got foot massage requested additional pain medication at a 3 times lower rate than those who didn't get the foot massage. And then when they looked at anxiety levels using this measure called the straight trait anxiety, the people who had foot massage had a 28.67, and the people who did not have it had a 51.84. And this scale ranges from 20 to 80. So basically, by giving people a 20-minute foot massage, they were able to reduce analgesic use, reduce pain, and reduce anxiety. And so what's interesting to me about this study is when people say like, oh, after, if you give people a year, it doesn't matter if they got massage or if they got tissue work, like the recoveries are relatively the same. And what I see from this is, do we not care about how people feel during the process of recovery? Like, somebody feels less anxious, somebody has less pain during the recovery process, and they're putting less analgesics into their body. It's like, people want to argue about the mechanism of soft tissue work, but here we can look about how does it subjectively affect somebody in the process of recovery. So this is an interesting study, and basically what they said was they attribute it to the stimulation of the dense amount of nerve endings in the feet, and how that basically creates like an endogenously produced analgesic. So that's study number 2, looking at the foot massage. Study number 3, in this study, they were looking at people who have tension type headaches, and they used 3 different interventions in addition to everybody getting heat, everybody getting exercises, and everybody getting stretches. So everybody got those 3 treatments, and then what they did was they varied with an additional manual treatment. So one group had IASTM, like metal tool scraping, done on their upper traps. and on their suboccipitals. Another group had, in this study, they call it algometry pressure release, but essentially it's ischemic compression or trigger point therapy. Like they press on tender points and they held it for a minute multiple times. And then the third group had a sham ultrasound, basically just to make it look like they were doing something. So the sham ultrasound group was essentially the control group that just got exercise, heat, and stretches. And then they looked at the outcomes that they looked at was they looked at headache frequency. They used the HURT questionnaire scores. They looked at pressure pain threshold and cervical alignment on X-ray. And the results, basically results. All the groups had reduced headache frequency. So the interpretation there is that natural history, stretches, heat, and exercises help. But the IASTM group and the algometry pressure release groups, they had more reduction in headache frequency. So we know that from this study supports this notion that if we do a little bit of manual therapy on the upper traps and on the suboccipitals in people with tension type headaches, it's more effective than just doing heat stretches and exercises by themselves. And surprisingly, this was surprising to me, was that the IASTM group had actually better outcomes in these other categories than the ischemic compression group. They had more improved HURT questionnaire scores. They had more improvement in pain pressure threshold, and they had some alignment differences on X-ray that the algometry pressure release group did not have. So this, like the way I interpret this is like, okay, somebody has headache. We know stretches and exercises and heat can be helpful, but so is doing additional manual therapy. Like it is justified, and this study supports that. Okay, study number 4.
Ryan, just because, just so we don't move too far away from study 1 and 2, we did have a question here about the correlation actually between study 1 and 2. If you see it here from Kimberly Reeves, how does the hyaluronic acid correlate with the edema study or the edema results in study number 1, whether it's part of that healing profile?
That study didn't mention edema, so I don't know that I can say that was related. So I don't know that edema is related to the aggregation of these hyaluronic acid molecules.
Okay, so it doesn't necessarily have that profile.
Well, the study didn't look at it and it didn't talk about it, but I mean, we could think through physiology and biochemistry and think like, would it affect that? But that's not particularly what that study was looking at.
Okay, so yeah, maybe we can also
there wasn't.
No, we can even look back into it in the Q&A if Kimberly wants to add anything more specific there.
Yeah, we could. We could discuss that a little bit more.
Awesome.
Okay, let's try to go back to study 4. Okay, study 4. This study looked at how doing cross fiber friction massage with a metal IASTM tool, how that affects the vascularity of an injured ligament. So what they did in this study is they took a bunch of rats and they basically cut the rats' MCLs. So this is what they do in these studies. They take rats and they like do little procedures on them. So they cut their little rat MCLs. And then what they did was they had these little IASTM tools, and they waited a week after the way they injured it was they just went in there and just took a scalpel and cut the MCL. They let it heal for a week. And then what they did was they did 1 minute of cross fiber friction over the ligament. And they did that for 1 minute sessions 3 times per week for 3 weeks. And they used a pressure of 250 grams. And basically what they found was they measured 2 things. They looked at the perfusion of the tissue using I forget, like some Doppler thing or something like that. And they looked at how much additional perfusion of blood was in the ligament. and they found that after doing the cross fiber for like 24 hours, they would have increased perfusion into that tissue. And like that's how tissues heal, is by getting blood flow that brings the nutrients. So having increased perfusion would be helpful in that sense. And then the other thing they did, and what they found, was that there were actually more arterial sized vessels in the ligaments that had the cross fiber friction massage done. So not only was there a short-term increase in the perfusion of the tissue, there was actually a change in the amount of blood vessels. So the authors of this study suggest that, like, if there's a ligament that you are treating and it's close to the skin, so you can get close to it and actually mechanically rub it, that if you just do that for 1 minute a couple times a week, you can actually like help the healing process via tissue perfusion and increase blood vessel density. So you get better blood flow to these healing tissues, which should allow it to heal better. They didn't actually look at the healing. They were investigating specifically the effects on the vascularization. So that's my takeaway, like at least from a sports chiro point of view, is like, if I was doing exercise or rehab with somebody for a ligament issue, I'll spend 1 minute doing if there's research to show that I can affect the vascularity and the perfusion of the tissues, I'll spend 1 minute just doing a quick cross fiber on that ligament. I mean, why not? It's not doing any harm, and it could be potentially helpful for these mechanisms. Okay, let's go to study 5. Study 5 is similar. It was actually done by the same authors, but not at the same time. What they did here was instead of looking at the vascularity, oh wait, we have a question. Does this study also include cases with Ehlers-Danlos syndrome who are prone? No, it doesn't. They didn't talk about that because what they were looking at specifically was they were just looking at the changes in the vascularity. So they were doing a very controlled thing on these rat knee ligaments where they were just looking at the vascularity. So they didn't extrapolate it to any other sort of syndromes or anything. Okay, and so this study for number 5, same authors, probably different rats. They did a similar thing where they cut the rat MCLs, and instead of looking at vascularity, they actually looked at the tissue of the ligaments. And so they had 2 groups. They had 3 groups. They had a control group. They had a group that got cross fiber friction over the ligaments for 3 weeks, and then they had a group that got cross fiber friction for 10 weeks. And they looked at the actual ligament and its mechanical properties. And the results were a little bit, they take a little bit of interpretation. So they did the same thing, 1 minute of the instrument-assisted cross fiber massage for 3 times per week. And they looked at the ligament's collagen structure and the mechanical properties. So they found that the early stages of the recovery, there was more benefit than doing it for a long period of time. So the group that had this done for only 3 weeks almost had the same amount of benefits as the group that had it done for 10 weeks. So one of the suggestions the authors made was that this could be beneficial in the more acute phase and not so much in the longer term phase. They showed that the massaged rats compared to the control rats, they had the ligaments absorbed more energy. They were stiffer and stronger than those that didn't get the treatment. And they had more fibroblasts and better aligned collagen when they did a histological examination of the tissue. So just by including this cross fiber friction, they had mechanically stiffer and stronger tendons. And the reason for that would be what they talked about in the second part, which was due to more fibroblasts and better aligned collagen. So it's not necessarily this study didn't look at are we breaking up scar tissue? Are we breaking up anything like that? Their suggestion was that by doing cross fiber friction over the ligament, it's creating a pressure inside of the fibroblast. And that pressure is stimulating the fibroblasts to function more. And so that's why they have better aligned collagen, because the fibroblasts are doing a better job because they're being stimulated mechanically. Okay, so that's study 5. Study 6, this is more of like well, study 6 is useful, but it's also like an opportunity for me to market. But basically what they did was they looked at manual therapy, or they looked at physical therapists who perform manual therapy. And they looked at the prevalence of thumb pain. And they looked at why are therapists having thumb pain? What are the contributing factors? And what can we do about it? And basically what they found was that if you're not aligning your thumb, like if you're doing a lot of work with your thumbs like aligned like this, it puts a lot of stress on the joint here. And they said you should align your thumb better, and this or use a reinforced thumb, or, and this is where we plug our product, is one of the ways you can use it is by doing ischemic compression without having to use your thumbs. Okay, let's go on to study 7. Study 7 was looking at the effects of back massage on sleep quality. And specifically in this study, they were looking at the sleep quality of postpartum women. And so they used quality, they were just looking at the quality of sleep in postpartum women. And initially, 86% of participants were poor sleepers. And by the end of the study, 60% of the women that had the back massage recorded a good quality of sleep. And basically, like, again, this is one of those things that like the very research-driven therapists who argue against manual therapy, it's like, they're not like paying attention to like, how does my patient sleeping? And if we think about like somebody who's not sleeping well is not functioning well physiologically because they're not having the time to recover. And if like this study just shows that if somebody gets a massage, they sleep better. Like how powerful is that? Like how many people take sleep medications because they can't sleep? And if they get a massage, their sleep improves. Like, I don't know. I think that's a really cool study to be able to show that that is actually happening in a way that's being objectively measured. All right, study 8, fibroblast response to variation in soft tissue mobilization pressure. Basically, this study, we'll talk about the product. Okay, so basically this study number 8, was looking at fibroblast response to variation in soft tissue mobilization pressure, essentially looking at the minimum amount of pressure needed to activate the fibroblasts. And this was done in tendons. So the previous 2 studies where I talked about the rats, those were ligaments. In this particular study, it was the tendon. And again, I think they were picking on the rats. So they really like to mess with rats. So they basically they induced Achilles tendonitis in these rats. I think they injected the tendons with some sort of saline or something to create a tendonitis. And then what they did was they tested different pressures with their IASTM tools that they were using. They tested a 50 gram, 100 gram, and 150 gram pressure. And what they noted was that basically like until they got to the 150 gram pressure, there wasn't very much enhanced fibroblast activity or more fibroblasts. So this study basically said, we think that the kind of minimum pressure that you need over a tendon to activate the fibroblasts through that mechanical pressure is 150 grams. So you guys will have to get out, like you'll have to get like a little kitchen scale and measure out 150 grams just to see what 150 grams is like. Study number 9 was the effects of instrument-assisted soft tissue mobilization on lower extremity muscle performance. I think this is a really interesting study because, I mean, although they did it with IASTM, I mean, we could kind of extrapolate it to other forms of soft tissue work, I think. basically what they did was they had people, they did a couple jump tests. So they looked at jump height, peak power, and velocity. And then one group got 3 minutes of IASTM on their quads, on their calves. And then the other group didn't, they just rested. And then they looked at another jump test, and there was no change between the groups. So basically, because some people think that doing IASTM will increase muscle performance, and I think it's important that we look at the research that also tells us things that it's not doing. And this study showed it's not doing that. And I think it's good to have like a balanced view of what we do doesn't fix everything. It doesn't help with everything. It's important that we know, okay, there is studies to show this. There are studies to show this. There's probably other studies that maybe show that we can enhance muscle performance, but, or maybe recovery. Like if there's like if somebody got to like a lactate threshold or something, maybe, but this, at least for the jump height and peak power and velocity, no. Recovery, not covered in this study. But I don't think we should say that this type of work enhances muscle performance, for example. And study number 10, the acute effects of assisted soft tissue mobilization for improving posterior shoulder range of motion in collegiate baseball players. What they looked at here was they measured the horizontal adduction and internal rotation of these college baseball players. And then what they did was, so they measured it, and then one group, the treatment group, received a 40-second IASTM intervention, basically on the infraspinatus, teres minor, and I think the posterior deltoid is what they did. And the control group just sat there for 40 seconds. So one group had that 40-second treatment, the other group just sat there. And after the 40 seconds, the treatment group, they had an 11.1 degree increase in horizontal adduction, passive range of motion, and almost a 5 degree increase in glenohumeral joint internal rotation from 40 seconds. And when I read that, I go, okay, that's probably a temporary increase. I mean, I'm sure a lot of you have that experience where you do some sort of tough soft tissue work, you have a temporary increase in range of motion for a variety of reasons. And I see that as, okay, if somebody gets 11 degrees more or 5 degrees more of internal rotation, I have like a window of opportunity to work with that person to improve their motor control and their coordination and all of those things in those ranges that aren't usually accessible to them. So I see that as sort of a training opportunity. So 40 seconds, then they have this new range of motion, and we can work on some different exercises that maybe weren't available to them in certain ranges. So that's kind of how I interpret that study, to look at like ways of working on larger ranges of motion than are usually available. Okay, so those are 10 studies that I found in my research review on a variety of different effects, both like objective and subjective, that look at some of the mechanical properties, some of the subjective reports, things like sleep quality, et cetera, that I think are important to know, because it's good for us to know this stuff so we can communicate clearly and be like, no, we know that this is happening for this reason. This is what we think is happening biochemically. This is what we think is happening with the cells and in the different tissues. I didn't find any studies that showed like breaking up adhesions of scar tissue. I didn't find any studies that showed that there was, because a lot of people when they do IASTM, they'll do it and they'll get a lot of petechiae on the skin, like where they break the capillaries. And there wasn't any studies talking about that being good or bad, because a lot of people talk about that. I didn't see anything about that, which I found interesting because it's kind of like a hotly debated topic. Anyways, those are the 10 studies that I wanted to share with you all today. I hope this was interesting. Hopefully it was useful.
We can jump into the question just because it's about the last study, and then I'll kind of break from the studies for a second, ask you a few questions, And then we can open it up to also the entire audience for any questions that anyone may have. This is the time to punch it into the chat box or Q&A box. So yes, I'll let you respond to Victoria about the calling off in study 10.
Yeah, so in study 10, they didn't look at that. They weren't looking at what happens at, say, your English is great, I understand perfectly. They didn't look at what happens after an hour, what happens after 3 hours. They just looked at it like in the immediate change. And that's a lot of times when people read studies or when authors do studies, they have to look at just one or two very particular things. And that's where at the end of the study, they'll be like, this raises more questions of future research. So that would be a great study for somebody to do, is like repeat that exact study, but then look at the effects 2 hours later. How long does that range of motion last? Do they keep that 11 degrees for 5 hours? Do they keep it for 1 hour? Not something that was talked about in the study, but definitely an interesting thing that would be useful to know. I don't know the answer to that question, but it's a great question.
So I was want to break from the studies, per se, for a few minutes, just to get a bit of context around where you, as an individual, Ryan, and as a practitioner, are coming from. So based on your experience, do these things make sense? These topics, because it's all stuff that are very helpful, just to see from an evidence-based perspective how, whether you're a chiropractor or massage therapist or athletic trainer, anyone who's performing these manual techniques on clients, on patients, on athletes, proves to some degree of the value of the work that's, involved. And even if it's a bit of it on a continuous basis, people are seeing results. So, but does it support, based on your experience and your work with clients in the past and patients, does it support what you've seen?
Yeah, I mean, I can't tell you how many people, like, I think about that last study, particularly about the short-term increase in range of motion post soft tissue intervention. And I mean, so many people would have like a very stiff neck, and I would do like 1 minute or less of very light scraping or with my hands on their the different muscles in their cervical spine. And you can just see the range of motion increase so much. And that's when people say like, oh, you should, like, physical therapists do this a lot, because they're like a little bit more hands off a lot of times. So there's like an outspoken kind of subgroup of physical therapists who like think that touching your patients is like stupid and you shouldn't do it. They're vocal, and whenever I heard them say that, I'm like, I'm literally seeing people's range of motion and like pain-free range of motion increase, and then I see their mood improve. I remember this one guy, like, he was a friend of mine, and I was treating his wife, and her neck was all stiff, and I did some very basic work on her, some of the muscles, and she was like, oh my God, I can move my neck. And he's like, thank you. Thank you. You made my life so much better. And so I'm like, think about we, like, as body workers, I always think like, as body workers, we're like a source of positive energy in the world, because there could be a person who feels bad and they're upset, and they're kind of irritable. And so then they're kind of irritable with people around them, and maybe they make some like kind of mean comments, and then that kind of ripples out because they don't feel good. And then they come to us, and we, through our knowledge and skills, can use these things, these tools that we have of manual therapy. Then they feel good. We're literally like creating pleasure chemicals in their body, and that changes their mood. That changes how this lady interacts with her husband. That changes how he interacts with his colleagues at his job. And so it creates this ripple effect. And so we're essentially like a source of positive ripple effects in the world through this work.
Study, yeah,
And
maybe
so,
study number 11. How many marriages have body workers saved?
wow.
What do you think is the source of the the vocal naysayers out there on the internet where you started the presentation before you jumped into the studies? Where do you think that stems from?
Well, I think that it stems from a limited perspective. Because, for example, I kind of alluded to this a little bit. So let's say that somebody has an injury to their neck. Okay. And let's say we do a study where one group gets soft tissue work and exercises, one group just gets exercises, and then after a year, both groups are the same. Okay. That group would say, look, you're wasting your time. Why are you doing that? The outcomes are the same after a year. What does it matter? And my perspective is, yeah, but what is happening during that year? Like, so that's why, for example, I thought that study on the anxiety of the people who got a laparoscopic cholecystectomy or the gallbladder removal.
Mm-hmm.
Yeah, maybe they have the same outcome, but they have less anxiety. Do we not care about the short term? Do we not care about the process that another human being is going through when they're having pain in their body? Like, your body is, you live in your body. People live in their body. If something hurts, it changes your entire perception of reality. And just because, oh, their range of motion was the same a year later, yeah, but they suffered more. Or, for example, it's like, let's say exercise, let's say this, imagine somebody has shoulder pain and their shoulder's been hurting for 6 months. Are we saying that there's no value in doing manual therapy? And that might be the thing that is the first time in 6 months they had a pleasurable sensation in their shoulder. Like, oh, they always think about their shoulder, oh, it hurts, and when I do this, it hurts. And then they come and get some work done on it, and it's like, oh, that felt good. Oh, my shoulder can feel good. I forgot that that area, that region of my body could actually feel good. And it's like, what is the impact of that? So I think it's sort of just like a reductionist viewpoint. I think some people also just like to create anger and outrage to get attention on the internet. I think that's very popular. Like, I don't know. I think a lot of them are cynical, and I think cynicism is like, cynicism is an emotional disease in a sense. Like, so I'm trying to like offset the cynics, I guess.
Yeah, or maybe they need to schedule a session for themselves as well.
Well, some people's cup is full already.
Yeah, fair enough. And from your perspective, can you walk us through? I know you mentioned your product.
Can I answer this question from Michelle?
Yes, please.
She said, wouldn't that soft tissue range of motion be a false positive, but revert to injury pattern should there be an underlying skeletal block? Michelle, I'm not sure what you mean by the underlying skeletal block. I do think that if somebody has, let's say somebody had a previous history of injury in a joint, and they have a lot of unconscious neurologic guarding of that area. My hypothesis would be that, like, if we do a little bit of soft tissue work around that joint, and that decreases basically the tone driven by the neurology, and that allows them to feel these new ranges of motion, that might give them like the ability to restore normal function of that joint. But there is a flip side to that coin, which I think maybe is what you're talking about, which is that might also be protective. So I think there's an important thing of knowing, is there tightness and stiffness and guarding as a real protective mechanism against or for some sort of underlying tissue injury? Or is it due to basically the nervous system getting kind of wired in this protective way, and now it's chronic, and they just like it actually is okay for them to move in that range of motion, but they've been tight and avoiding that for so long that like the brain and the nervous system doesn't know how to coordinate putting that joint into that position, having the muscles be under that length, having certain tension in the capsule or around the ligaments, because all that stuff, you're getting the sensory feedback into the nervous system. So like imagine if someone's arm, like they haven't extended it out in front of them. So then they put that joint into that position, it lights up all these proprioceptors into their brain, and it goes in their spinal cord and it loops back, and it basically like prevents the muscles from relaxing by driving tone. Sometimes that could be useful. Sometimes it could also be the thing that's preventing them from restoring normal function. So I don't think it's necessarily very simple. It would be easier if our clients listened to us more. Giving people pain relief gives them hope. Pain is depressing. Yes, pain is super depressing. Pain can completely turn, it like literally does turn someone's life from being in color to black and white. And we are like the front line of restoring color vision to the people's lives. And yeah, Nancy says there could be an emotional aspect. There's definitely an emotional aspect. I mean, I have my own personal sort of experience with chronic pain in certain joints, and I remember feeling like a prisoner in my body for like years. Like I felt like, because I had like pretty bad low back problem, and it was like I was a prisoner in my body. So I've like deeply felt the emotional and sort of like the emotional side, as well as how that then affected my productivity in the world, my relationships, etc. So I think it's important that, yeah, I mean, we're humans. We're not just robots. Like we have other systems beyond the musculoskeletal system.
Yeah. So Ryan, talk to me a bit about again, from your perspective, the IASTM tools that kind of have two, angles to look at them. One from the perspective of the practitioner, how it can help the practitioner, but then also from the angle of the patient, the client, the athlete. So talk to me so from the latter, from the patient's perspective, the client's perspective, what has the general feedback been? Also like looking at manual therapy work or, touch as a healing aspect when it comes to using tools.
Well, I've done a lot of cupping, ischemic compression, joint manipulation, joint mobilization, scraping with IASTM tools. Those are the main modalities that I have experience with. Like I did a lot of pin and stretch. I'll just give you my personal opinion. I think our hands are incredibly valuable assets as therapists. I mean, like our ability to think, our ability to emotionally connect with somebody, our ability to communicate, and our ability to use our hands and our bodies in general to do like the physical part of the job are very important. And I don't think anything can replace our hands, which is not something I like think that we should do. But I also think there's a time when it doesn't need to be our hands. So this kind of gets back to like what you were saying at the beginning of the talk, which is like, and it's something I feel very strongly about this, which is we don't need to be martyrs for our patients. Like we should not create a problem for ourselves when we're helping somebody else. We should be treating people from a position of strength as much as we can. That's why I put study number 6 in there, even though it's like kind of like a very subtle little marketing thing to like, 60%. But the thing is, 60% of physical therapists who did more than 20 hours of manual therapy per week reported having thumb pain. And I think our thumbs, like to perform ischemic compression or pin and stretch with your thumb, it's like, does it have to be your thumb? Does it have to be this biological tissue that has joints that we're now stressing hours and hours and hours a week? Or can we use other objects to create leverage to not have to stress our joints in that way when it's not necessarily better? So I used a bunch of tools. Basically, like every IASTM tool is flat. And this is a really important thing to understand, I think. Like most IASTM tools look like a knife with a varying curvature. And basically the way that those tools are made is somebody just makes up some curvature. They go to a company that has a machine called a CNC machine. A CNC machine basically takes a piece of flat stainless steel and it just like carves it out. So like a flat tool, those should be super cheap. It's a very cheap, easy process to make those. And like they're exorbitantly priced. Like when I was in school, the only one available was the Graston tools. Those are like $3,000 for 6 tools. I bet it costs under $100 to make that set of tools. I mean, $150 max, and they're selling it for $3,000. It's like, that's 20x. Like that is absurd. So what we did and what I did was, because I didn't do just scraping. I also did pin and stretch. I did ischemic compression. And so I designed this like 3-dimensional tool that has edges where you can do scraping, but you can hold it like in a bunch of different ways. It's like you don't have to pinch it like you would with a flat tool, and then your hand intrinsics get super tired from doing that all day. You can like grab it in all these different ways. You can like hold it like this, and then this part goes into the web of your hand, so you can do ischemic compression and you're not actually loading the thumb. You can flip it over this way and scrape with this edge. You can, this essentially simulates a closed fist. But your question was, how do patients, feel about it? And people who, I think it's more about the provider. I mean, some patients will prefer like for example, okay, let me think how I want to answer this question. I'm kind of rambling.
You're giving valuable information and context.
Yeah, I look at it more from the provider's point of view, because we're the ones doing this 30, 40 hours a week. We're the ones who are using our bodies to help other people. Patients like it enough. I mean, people our customers are always like, oh my God, people love how it feels. And people love how most IASTM tools feel if they're not super sharp. Yeah. There was this belief previously that the tools needed to have like this it's like what Graston basically patented, the angle. So they got a patent on the angled metal tools or something. So nobody else could make them. That's why they charged $3,000. I mean, that's obviously gone now because their patent expired. So the market is making their prices lower. But they used to be really sharp, and then that would create all this skin irritation, and people thought that skin irritation was a sign that it's effective, but that isn't true. You're just breaking capillaries in the skin. So this tool is not sharp. It's more blunt, which people really like. But again, I really see it more from the therapist side as a way to reduce the stress on your hands. Like one of my little like slogans is use your, I think, you ever watch Mad Men?
Yeah. The first couple
so
seasons.
I was like, okay, what would Don Draper say? He'd be like, use your hands when you need to and use T-tool when you don't. Like that's how I think about it. Like save your hands for when you really need to use your hands. And then when there's times when you don't need to use your hands, use the tools that are available to make your job easier. I mean, so what I did was I tried to make something vastly different than other products out there, like something that I could do ischemic compression with, something I could do pin and stretch with, and something that I could do different scraping work with. So anyways, that's why I made this.
Yeah.
It's super tricky. It's super tricky to make because it's not a flat thing. Like we had to get it has to be like molded in a 3-dimensional mold. It's way more expensive to make. So anyways.
But do you like when you got started off in your career, was that something that was like on your mind? Just also like thinking about your career long term as a body worker?
Well, I mean, I did ART, active release technique. I was really into, because actually the reason I went to chiropractic school is because I had an injury and I went to a bunch of different people, and then this chiropractor that specialized in ART really helped me, and I was like, oh my gosh, I want to help people the way I got helped. So I went into chiropractic school to do soft tissue work, and I just saw it as like the license that gave me the ability to do that. And then I was like, man, my thumbs hurt all the time. Like, you want to know, like the telltale sign is when you see a therapist going like this, and they're like, oh, they're trying to deload their like CMC joints and stuff. And that's a real problem, because that study number 6 showed that like people have to get that joint replaced in their thumb. Like, some people have to get a joint replacement because they get really bad arthritis from loading it, from like excessive loading,
or stop working.
Right, or stop working.
Yeah.
And then it's like, well, if we could just like implement a few easy things to reduce stress on that joint while still helping patients essentially the same way, I think that would be, I think that's a good thing. So anyways, that's why I made it. But so I had personal experience with my thumbs hurting. I was traveling a lot and teaching a lot of at a lot of CrossFit gyms, and from between 2013 and 2018, I was teaching a lot of movement related stuff at CrossFit gyms, and I would talk to therapists, and they all said the same thing, like, oh, my hands. Anyways, and then I made this. But
amazing. Yeah, no, which is good, and we will share. We can share where exactly to find the product, etc. It's on our website at neilasher.com, but we can also mention your website too. We have a few comments here and a few questions.
Yeah.
If you wanna maybe scroll up a little bit and sort out. Yeah, you tell me where you're comfortable starting.
Yeah. Okay, I'll go. Okay. Chronic pain rewires the brain. Do the tools have to be metal to be effective? No, I don't think so. I don't think it really matters. Not sure which study, maybe 4, when trigger point therapy. Is it easier to find the trigger point with the thumb or with the tool? I think it's easier to find it with your thumb, but like, let me just show this real quick. So if I take, one of the things that's like really cool about this is you can hold it between your fingers. So I can basically hold it like this, palpate. So I'm like palpating, I'm doing stuff. And then I just like, you just rotate in your hand, and then you can press right on that spot. So palpation with your hands, I don't think, like, the tool doesn't have receptors in it. You can't feel what the tool feels. I mean, you might be able to feel like some roughness, I guess, but these things are way better at sensing than a piece of metal. So for sure, when it comes to palpation, I would definitely choose my hands. That's one of those things that, like, you're not going to replace your ability to feel with your fingertips. In implementation, would the increase in range of motion be counterproductive in certain athletes? Would it affect power production? Yeah, so that's a great question by Najet. I don't know if I'm pronouncing that incorrectly. I think you have to be, that's a very astute question, because there is this underlying assumption that increasing range of motion is the end goal, and that's not necessarily always the end goal. Like, it isn't, the goal is not to make everybody have as much range of motion as possible in every circumstance, because if that was the case, there would be no like balancing tone to actually control load and force and stuff. So yeah, you probably don't necessarily want to try to increase range of motion before an activity where you're basically trying to maximize like control and power output. So yeah, I don't know that, like, that's one of those things where, like, okay, so if we think about the study that showed that the cross fiber helped with perfusion of tissue perfusion and arterial sized blood vessels, that's one of those things where I would think clinically, okay, there's like no potential downside I can see to doing this. But if I think about trying to do soft tissue work before somebody's doing a sprint, then I say, there's no evidence to show that it was better, and I could definitely see why this might be not a good idea. And I'm sure everybody who's here is more of a conservative therapist. I mean, if we weren't conservative therapists, we'd probably be like surgeons or something. So I think the conservative approach is, if there's a downside without clear reason to think that there's an upside, I don't know that I would do that. Felix, can you tell some information about soft tissue testing devices? I don't know anything about soft tissue testing devices, so I cannot answer that. Can we use gua sha tools to do scraping? Sure. You could use, people always joke like, I use a spoon or I use a butter knife. And you could use a spoon or a butter knife. The only reason I don't think that's a good idea is I never wanted to be the chiropractor where the lady goes home and she goes to her friends and she goes, I went to a chiropractor and he rubbed a butter knife on me. I don't want to be that person who's like the chiropractor who's rubbing spoons on people. I just don't think that's like the reputation I want. Not that I think that it wouldn't work, because I think it actually would work probably pretty good. I just don't want, people don't understand that. Like, chiropractors are crazy. They rub spoons on people. I don't want
to looking when I think from the client's perspective, what that looks like.
Exactly. I mean, imagine if you went to a dentist and they were like using like
a drill.
Chopsticks.
Or like a drill.
He's like, he has 2 chopsticks and he's tying the floss around it. And like, why are you doing that? Just use like the dental thing. Does it stress your wrists? I think referring to T-tool, I think it definitely does not stress your wrists. And one of the things about one of the things about the design is like, you can hold it. Like, for example, if I was, look at this beveled edge right here. If I wanted to do scraping with this beveled edge, I could hold it like this. And I mean, I have to like raise it so you can, like, I could hold it like this to do it. I could put my fingers between the stem and I could do it like this. Some people call this like the mouse grip, because it's like, computer mouse. So I could do the mouse grip. I could then also hold it by this side and I could do it like this. So one of the things that the design of this tool allows is that you can change your grip, because even if you grip like the most ergonomic mouse, eventually your body gets tired of the same exact position. So I think the ability to change positions is really important, any sort of repetitive thing that we're doing. Yeah. Silicone cups work great. Yeah, silicone cups are awesome. I love those things. My phone will, okay, that's unrelated. Learning to calm the CNS creates calmer tissue for sure. Calming down the CNS, getting some parasympathetic stuff going. I don't mean to spam your new tool, but I think all manual therapists would benefit from the melt method treatment to prepare your hands. Look, I will say this. The underlying goal of this company that I'm building with this tool as one of the products is helping therapists treat their patients from a position of strength. So if you're saying the melt method helps your hands, I support that 100%, because that's really what that's like the underlying thing I'm trying to do, is help therapists not have problems helping people, so that we can create this positive sort of like momentum in a world full of problems. So yeah, anything that can help. My gua sha looks like a credit card. Yeah, there's some credit cardy looking ones. To be honest, I'd be impressed with that dentist. Actually, I don't even know if the
chopstick dentist.
Yeah, right. I don't know if the dentist even does the flossing. I think it's the dental assistant. So
or the hygienist,
or the hygienist.
Yeah.
Right, should we look at the Q&As?
Yeah, I think that it's a duplicate in the Q&As.
Can you tell some information about? Oh yeah. Okay, so that kind of was both. This tools can't damage the tissue and bone.
Question.
Well. Yeah, the TSA thinks it can, because if you travel with one, they're like, I actually think I could hurt somebody more with my laptop because it's like sharper. Like they've confiscated this tool because I had my backpack, but they let me have a MacBook Air, which is like a knife. So you could hurt anybody with anything.
Yeah. So look, we've been online for about 65 minutes.
Understanding all
there's one more question coming in there.
No, I think it's more about just a general statement. understanding that all patients have PTSD from injury and other matters. When we become aware of this, we can perform better. Yeah, the emotional side of a lot of emotional pain stuff gets tied up, creates a lot of emotional, psychological Rubik's cubes to solve, essentially.
So thank you. First of all, thank you, Ryan, for all of that. That was really awesome. Super insightful and educational as well from a couple different angles. Thank you, everyone who has joined us for this live webinar, live class that we do. We do hold one of these every month. So please make sure to subscribe to our emails and social media and updates to register for the following ones. On our live class page on the website, you'll see the scheduled one in the next few months, so you can already register for those ones. Ryan, do you want to give everyone a quick summary of where they can find your more information about your company, about your tools?
Yeah, so I'll just type the URL here. So this is the URL for the website, but it's actually because we've been working together, you guys and our company, and you actually offer it at a better price on your website than we do through our collaboration.
Yeah.
Would you give us your PDF? Yes, I would love for you to have the PDF. Why
yes.
don't I?
So anyone who, you can paste the link of the PDF already in the chat?
Yeah, give me a sec.
Amazing.
I think I can. If I'm as tech savvy as I think I am.
And I will drop the link here for the T tool, which is listed on the neilasher.com website with a discount. So anyone who is here live and is interested in it, you can find it on the link that we just dropped now. So you have the PDF there. You have the link to our website, neilasher.com, with the tools, and you have the link to the ttool.com, which is Ryan's company's website. So I want to make sure that this it works, the PDF that you sent, and it does. So,
Perfect.
So beautiful. So Ryan, thank you very, very much. Highly appreciated, super insightful. I appreciate our collaboration, our partnership, and I hope we can maybe discuss more studies that will come out in the future that will help us with tool, without tool, body work, things to help navigate this world of certain cynics, naysayers, and just learn how to approach everything in a way that will help practitioners keep developing and learning, but also help the clients and patients at the end of the day feel less pain and get better from whatever it is that's restraining them or holding them back. So Ryan, thank you.
Yeah, thank you, and thanks for everybody spending time here and chatting and listening. It's just like I just can't keep coming back to this idea. It's like I'm like possessed by it, which is like the opportunity we have as therapists to make like real positive effects is just I think it's so important to connect with that, because it's what the world really needs. That the world really needs healers spreading like good things, and we we're all trying to do that, and we're trying to do it in a way that, again, this is one of my sort of overarching themes, is because I see this I saw it in myself, my classmates, a lot of the therapists and professionals that I work with, is like there's this mentality that we almost have to like sacrifice ourselves in helping our patients. And I think we have to put, like, we treat from a position of strength. We can best help others when we are in a position of strength to help. And I think that it's important to remember that, because we can oftentimes in this profession, we're so empathetic and so giving that we don't put ourselves first, even though putting ourselves first is sort of like the most selfless thing to do, because it's the thing that allows us to help the most, which is sort of counterintuitive. A lot of times we think that we have to like never think about ourselves and just help. And it's like, well, I help better if I'm good.
So important message, in I think in bodywork, manual therapy, and in life period. So great, Ryan. Again, thank you. I appreciate you joining all the way from Argentina. I wish you well. I wish everyone a lovely weekend. We had people here join from Australia, from Serbia, from India. So really
Very
fantastic turnout. So thank you very much, everyone who has joined. Hope to see you again on our future live classes and webinars. So thank you very much. Keep your hands healthy. Try out Ryan's tool. And wishing everyone a fantastic rest of your day and fantastic weekend. Thank you very, very much.
Thank you.